Hi, everyone. My name is Angelique Slagle. I'm head of SAP Success Factors for North America. Welcome back to our next episode of Experiences Unfiltered, where we'll have real conversations about real experiences. As you're aware, I created this series because I love the idea of kind of looking at experiences because they are literally everywhere and everything that we do. From the moment we walk into a restaurant, whether we realize it or not, it's not just about the food, it's about the experience, the ambiance, the customer service, what it was like to even walk up into the restaurant, what's the wine selection or the menu options. And when we think about 2021 and 2020, we have had major changes in our work-life experiences and still even now adapting. I know I have two children headed back to school this week, and there's a lot of talk about what this year will look like for them. We know COVID has really changed the way we adapt to travel, work, school. And so we'll talk a little bit more about all of those things. And I'm really excited about my next guest. I'd like to welcome the COO and president of Kindred Healthcare, Jason Zachariah. Jason, please give everyone a warm welcome.
Thank you, Angelique. Really honored to be one of your early guests in this podcast series, and obviously our business relationship now transforming into even a friendship and getting to know each other. Looking forward to sharing those thoughts as we go through the podcast today.
I am as well. So before we dive in, I just wanted to get the thoughts about the gift we sent you. One of the reasons we created this platform was also so we could highlight underrepresented businesses and how they're changing the game. Our last episode, we highlighted a tea company, and we'll continue to spotlight these organizations. Today, we are highlighting Mood Room Candles. I'm a candle junkie. I have them in pretty much every room, so I was really excited about this one. Mood Room Candles is an all-natural soy candle company that takes you to the place you think of fondly or aspire to be, reminds you of a familiar happy time or place, and gives you your own personal escape. I have a Tranquil Garden as the candle. I'm actually burning it right now. It's wonderful. Jason, what scent do you have, and what do you think of the candle?
Yeah, you guys, Mood Room Candle sent me Seaside Haven, which was actually very appropriate. I grew up in Jacksonville, Florida, near the beach, so brings up a lot of boyhood, teenage memories. Now with a family of 3 and wife of 25 years, who also is a huge beach goer, that is a sanctuary, like for many families, for us to reset, to cleanse. It was an important place for us to retreat during COVID several times over the last 18 months, most recently Hawaii. And then also my family, my parents are from Kerala, India, which is seaside state in the southern tip of India, where the Arabian Ocean and Indian Ocean kind of converge. And so we eat a lot of seafood. It is where I fondly remember going on trips to India and being at the beach side there too. So it goes across a lot of cultural and family and also personal ties here. So those fragrances kind of always come back when I smell something like a Seaside Haven. And so it hit the mark on the mood it brings me in. And my wife has it right in the kitchen where I come in through the garage, and it was effervescing for a week. So appreciate the gift, and I think Mood Room Candles has a bright future.
Excellent. I'm glad you enjoyed it. All right, so let's dive in. So you are president for an acute healthcare company. So experience is really nothing new to you, right? It's the foundation on which you operate. And what's happened in the world in the last year, a lot has changed. So as a COO and president of that company, what would you say experience means to Kindred?
I mean, experience is everything, right? As a healthcare organization and a hospitality organization, it is front and center. I think most people, when they think of experience, and it's not just in the healthcare sector, they think of consumer, in our case, patient satisfaction, right? Family satisfaction. And it is actually beyond that. Satisfaction and centricity are a big part of that. But we at Kindred have also developed around our experience a couple other key pillars. It's quality, it's safety, and it's also equity, right? And so you think about those three additional pillars, obviously if you have a poor quality outcome or the intention of your hospital stay is not achieved, that's a bad experience, right? If you have an untoward event that causes more harm, the safety component, that is a bad patient experience. And then as we've really broadened in a diverse America that we had, if someone feels that they had a substandard level of care versus another diverse patient had a superior experience, and that could be around many lines of race and gender and orientation, that's a bad experience. So, when you start to put quality, safety, equity, and centricity, satisfaction into the overall experience, you start to cover so many domains that are so near and dear to us at Kindred. And if we can hit those marks across all of them, we know we're a fantastic healthcare organization that provides amazing patient experience.
I love the idea of, adding the equity piece, because it's like you said, it's one thing to deliver a favorable patient experience, but that's always in the context of potentially other patients. And I think that's the part that equity absolutely addresses. And so that's really great to hear. I remember early in our conversations, we talked about, to deliver the best patient experience, you said, I need to deliver the best employee experience. What's your strategy on being able to do that? How's it going? And what worries you about the ability to succeed?
Yeah. We're in an immense war for talent today. I mean, it doesn't take much to go into a restaurant, and sometimes services are limited. You go into manufacturing, it's hard to find a car, and then in healthcare, particularly nurses and therapists and physicians, we already knew that America was in a shortage for those talents in our healthcare space. And I think the COVID pandemic just accelerated that, and we came almost into a parallel universe on the backside, especially after vaccines came. There's a graphic we can share, but for the first time, we are seeing, the demand for services and this talent at an exceptionally high rate than ever before as an aging population comes in America. But that supply has completely gone the opposite diametric. So you're just seeing this graphic, and you can name said industry, and they're seeing very similar cases. Maybe less so in technology, but I gotta think technology and services has to be seen the same thing. So, I think part of this is also we have an aging healthcare workforce as well. I think maybe they would be looking at part-time work just to kind of fill some of the challenges and void. But the other thing I think we're seeing as well is just clinician burnout, right? And so when we wrap that into that statement you were saying, and I hold near and dear is, if we can provide a great employee experience, that will drive an excellent patient experience. It must be in that sequence, right? And all those 4 domains I said of experience, it's a clinician. It is a ancillary teammate who's supporting those clinicians that are creating all 4 of those pillars to be successful. And leadership is also part of that too. And when you have leadership that's burned out, especially being, full force, 150% to make sure they had a safe and caring environment under a scary pandemic, all those are coming into play right now. So as we've taken this into the next level of employee experience, has really been around, first of all, inclusion, belonging, a sense of real gratitude and recognition, and heartwiring that into our organization. That has been very profound across at least our Kindred leadership base, and I think for leaders across many organizations in healthcare and beyond, and not taking that for individual for granted. And so a lot of that has been driven in our core values. We've done a lot of recognition platforming work through our apps and just simple recognition components like a letter and everything. But just even tracking that, we're at on average 250,000 recognitions just on our recognized core app that we use. And, you've seen that when you take recognition, when an employee gets that on a written basis, it could be digitally or handwritten on about a month-to-month basis, compared to their cohort that does not get that recognition, there is literally half the level of burnout when they get that recognition, which is just something so simple in a leader's tool chest, right? And what more important time than now, right? As we talk about burnout, as we talk about retention and the need to keep employees. So that's on its purest form, right? And so having a culture of recognition, I think, is so important to be successful in this day and age. The second part is, around our inclusion and equity work for our own employees. This is about, creating a challenging environment that they're growing their skills, challenging in a good way, that you're investing in their future. And we've seen that through our own satisfaction or engagement surveys. We took one in 2019. We took a pause in 2020 just to fight the pandemic. And then 2021, we came back again. On a positive note, we saw a lot of our work around equity and belonging drove our inclusion index scores up by 7%. All of our domains of engagement went up by 2 to 3 or 200 to 300 basis points, which we were pleased to see because we were thinking it might be the opposite in a challenging environment. And we've had an all-time low on turnover in all of our divisions. So in a time that we should have faced the biggest challenges of employee turnover, we were seeing some of our best metrics and KPIs. But just because we see that doesn't mean that we need to slow or stay status quo. And so, going back to challenging and seeing our employees' future, it was, $10 million that we put into our employee fund to drive better on-ramps for education. So these were partnerships with Purdue University and getting $10,000 and $15,000 bachelor's and master's degrees so that folks could have an opportunity to skill up, to see promotions, both clinically and leadership role-wise. We had over 50 listening sessions, everything from, just the clinician burnout component, how we can address that better, to addressing social injustice and inequality that we were seeing, and just our employees wanted a place to talk about. And that empowered our organization to take very hard stands on Black Lives Matter, on pride, additional areas that we were taking bold steps, not just in words, but really in actions. And that was where we put audits around our promotions, around diverse gender and minority advancement in our organization. We were holding ourselves accountable to these things. When our employees saw that in a profound way, that's also in how many employee resource groups we stood up over the last 2 years, 5 of them, and the enrollment going through the roof. When our employees saw all of that coming together, they saw an organization that was committed, somewhere that they belonged. And I think those drove some of those KPIs that I was just sharing with you. So, overall, we saw increased experience, and we hope that's translating in what we're seeing in our quality, safety, and patient satisfaction scores.
That's just phenomenal. And what I love about what you talked about, Jason, is the fact that it's kind of looking at an employee as a whole person, right? Just not one aspect of their role. You talked a lot about, making sure that you're focused and committed on social initiatives that they might also be either interested in or impact. You talked also a lot about, challenging them in their own professional development, whether that's through reskilling or upskilling, or even offering them educational opportunities so that, even beyond Kindred, right, they have the right foundation, to continue to grow their career. And then the recognition, you're right. I mean, it's such a simple thing, but here we use it as well in SAP, and it just goes a long way. Sometimes you can send, with an SAP we have, you can send either a note or a small monetary gift to a person, and it could just be $25 or $10, and you light up. I mean, when I get them, I get really excited about them, right? And just the fact that someone is recognizing your work. You talked a lot about what's happening in the labor market, and particularly in healthcare. It has to be extremely daunting, right? Because you have patients' lives in your hands, at the same time trying to deal with the talent shortage. And we're absolutely seeing it in the tech world. And when I talk to customers all across various industries, it is something that we're all feeling. And at the same time, this is also, reintroducing or accelerating the conversations we've been having around future of work, right? We see the rise of a hybrid workforce. We see the introduction of automation that has some, potential to replace certain jobs or change the way we work. I was listening to the Pivot podcast yesterday. Actually, I was driving, and Facebook is actually really working on augmented reality and thinking about workspaces in that way, that you potentially could wear a discrete pair of glasses that puts you in a room with your teammates versus just being on Team and Zoom, which is actually, when I was thinking about it, it's like, wow, that could really change, some of the dynamic around, working from home. I'd love to hear how you see future of work and automation impacting the post-acute healthcare space.
Yeah, no, that's been a huge area for us even before the pandemic. Just start with one of our biggest areas is rehabilitation here at Kindred Healthcare, right? That's just our passion. And you see where robotics has come into the rehabilitation space, as well as artificial, intelligence and augmented reality and virtual reality in the solving of what has been age-old rehab problems. And that is, in rehab, you want repetition, right? Mm-hmm. In rehab, you want to see patients break through to the next level, right? And when you think about starting with robotics, repetition with a paralyzed patient or a brain injured patient is so key. And when you watch a, petite physical therapist and try to take a 250-pound, patient who has just had a stroke and is left side paralyzed, and trying to get them to get that motor function and neural activity reconnected, it could be, number one, a challenge physically for that individual, but something that they learned in school was a lot of manual input with that patient, helping them literally move their leg. I've seen duct tape strapped to a therapist and literally they're walking that patient. I mean, that is a employee injury waiting to happen and workers' comp risk. So I'm trying to solve for that. When you think about just the energy, and we talk about clinician burnout and what that would do to a clinician, and introducing robotics, where for some therapists, they thought that's going to take away my job. Number two is I don't have the skills to handle a $150,000 piece of robotics. But then when you train them and upskill them in what was taking a team of 3 or 4 therapists to take them safely down a 100-foot stretch to, it is now 1 or 2 therapists with the robotics. And you think about what that does to that employee who now takes woman, man plus technology and creates a better patient experience and better patient outcome. I'm all in on where this technology can go. As we take augmented reality and virtual reality, what creates a more positive space than you're in a gym and you see 3 other patients who are going through just as difficult situations. And now you put on the Oculus headgear and now are able to do rehab exercises by the beach, right? And having that seaside haven to now change mindset and to push yourself to that next level. That's where you get breakthroughs in your therapy sessions and your therapy plan. So we're really excited what this can do, but it's about, taking a workforce that maybe wasn't as technology adept, maybe starting to learn to put stuff into a medical record. And now that's becoming a huge part of their overall environment and how they provide care. It's a challenge, but also a real opportunity for us to advance patient outcomes and experience, and hopefully even shorten lengths of stay so people are getting home safely and quicker back into to their communities, and creating more efficiencies. Right now, our therapists and our nurses can handle more patients, or at least have more frequency and flow, and so that has real business outcome and as well. So we're excited where technology is going. I think also in terms of post-acute care, I mentioned that war for talent. Sometimes we don't always get all of our specialist physicians to come because they need to be at the acute hospital rather than in a post-acute setting like a rehab hospital or a behavioral hospital or a long-term acute care facility like we have. So obviously you start talking about telehealth and telemedicine and where we can continue to push on our capabilities because we have the entire conduit of skills of therapists, nursing, and physicians that maybe we couldn't access because they can't be there physically on the ground, but now can still interact with that patient and family in a very dynamic way through telehealth and these teleplatforms. And then when you think about post-acute care and we want to continue the care onto home and to be able to have patient monitoring and access and follow through with the patient, now you have a whole workforce that's working remotely and digitally that can still interact and create better outcomes. In healthcare, we used to think of, we take care of them in the hospital, and then some of those patients that can't go home need to come to the post-acute space or are directed into a behavioral hospital. We manage them there, it's in our lane, and then they go home, and there's another group of providers that take care of that. Payers, families, communities, they're not going to allow for that lack of accountability on what happens in the next level of care. So that's where technology really comes into play. And I think there's a whole tech workforce in healthcare that is just going to boom in terms of, how we monitor and see patients all the way to the home setting and assisted living, independent living setting, so that the whole end product or service is seen and wrapped in a bow better. And we're also preventing rehospitalization because we took the eye off the final outcome and the final destination of the patient.
There's just so much opportunity, I think, in healthcare and across multiple industries with this future of work for what I think is, positive disruption. And a lot of the things you mentioned, right? There's opportunity within it, and there's always going to be challenge whenever you're kind of transforming. But I see a lot of opportunity. So, part of the employee and patient experience at Kindred is also about creating, positive experiences for the community. You talked about the social initiatives that Kindred is focused on. And I know that this is near and dear to your heart. Can you talk a little bit about these programs?
Yeah, in terms of, healthcare, we like at Kindred, we like to be a big company that, thinks and experiences in a small company way. And and that comes down to the communities we serve. We're based in Louisville, Kentucky, but we have hundreds of communities we serve and largely in urban corridors. And so those urban corridors are what is a diverse America. Just at Kindred alone, 55% of our workforce is employees of color. 80% of our workforce is women, particularly working moms. And so, that goes back to how do we see, our communities through our employees, right? And so that goes back to employee experience and patient experience. But, how do we, start with our patients and creating that equitable, inclusive environment, not just for employees, but for our patients and how our communities perceive us. And so, number one, we've put a lot of work around health equity. I have a health equity officer who is solely focused on that initiative around safety, quality, around those diverse patient populations we serve. And so it's the data, it's holding our leadership accountable, it's cultural competency, and then the ability to work with our communities to show how we are impacting health in substantial ways, and then partnering with other healthcare entities from hospitals all the way to home health providers around that. And so how we're doing that is obviously investment in other not-for-profit organizations. $3 million we've committed that our local hospital frontline caregivers are choosing organizations that are helping drive that health equity mission. So it's partnership through that. It's about training, from unconscious bias training to our frontline caregivers from the day you join our organization around cultural competency, particularly around ethnic and other orientations that might be of a substantial population in our community that we serve and the patient population we serve. And what we're seeing is that that's ultimately driving a better patient experience score, right? That's what's driving ultimately more referrals into our care settings, because, you know, word of mouth, right? And sharing that with physicians in the community, with case managers, and our not-for-profit, particularly acute hospital systems, that are, it's near and dear to them. And so that's all kind of the tie around our work in our community, and why inclusion equity should be a part of the business strategy, right? And it's the right thing to do, number one. It's important for our people, starting with me at the top, and ultimately that's what our communities are seeking. And so hopefully that's business for the good, right? And that's where we're just continuing to put our efforts 150%.
That's excellent. Well, from the first day of us meeting and every interaction, you know, I've really been impressed with everything that you're doing within the Kindred organization. And I know it's a massive responsibility. So we would like to know, as we kind of close out today's episode, what are the personal routines or practices that you use to show up in life? And how does Jason show up to be the best Jason he can be?
A couple of years ago, we worked with organizations like Zappos and Disney and Southwest. And really it was about, number one, we needed to stand up our own set of core values. We had great mission statement vision, but we were missing what was the foundation of all of that. And that's a set of core values that we can aspire to and govern ourselves to. And so, you know, and there's some personal reflection in all of that. You know, we've got 6 core values. They're not one word types of values. They're really calls to action. These are simple as, you know, excellence is give your best, right? Doing the right thing always, to substitute for integrity. We obviously have strong beliefs in inclusion, and it's respecting individuality to create the team, right? And so real kind of statements that incorporate in our values. And so those 6 core values, I always state to everyone, they should not just be professional values when you come and work at the hospital that day. Probably by substituting one of our values, which is stay focused on the patient, and you change stay focused on the patient to family, friends, community, you could take all 6 of our core values and take that into your personal life. So I emphasize that, especially in a time of social media and where you see countless times of individuals behaving badly in their personal lives, and then it reflects poorly on them as individuals in their work life, on their organization. I also stress that. So I think I use those core values, and especially taking family and community and friends into that too. And that's able to reset me all the time. You know, it helps guide me. It's sometimes my decisions, a lot of times in my decisions outside of work. And I find that as immensely rewarding when I'm able to kind of combine my work and personal life together, and it feels right all the way around. I do not have to be someone different than who I am. I am the same leader at home and with my kids and wife and in my, you know, extracurriculars and the many not-for-profits I give my time to, and it's the same person they get at work, you know. And so very blessed that way, that it keeps me grounded in who I am. I'm immensely blessed to work at an organization that lets me be myself, and to bring my passions to the forefront and turn that into business strategy and a business environment, hopefully, that everyone likes to be a part of. And then I just find myself recharging where I need to, especially after everything we've gone through in this public health emergency. Finding that time, mine is with my family, mine is in the outdoors at the beach or climbing a 14,000-foot mountain. That is where I recharge as well. And then my recharge too from business is also, you know, you find yourself at the 30,000-foot level, and I take a lot of time to round and visit so many of our hospitals, even though it's a lot more donning of masks and PPE and the like, but it means so much for our employees to see those that are supporting, particularly their top leaders. They're recognizing them, being with them, and that gives me energy and also a focus on where our collective efforts need to be day in and day out, and that's to support our caregivers at the bedside and the gym side.
I love it. I mean, I love the idea that, you focus on your family, and recharging yourself, but also really listening and experiencing what patients and the employees, and from that you gain a lot of energy, and it's exactly the type of leadership qualities that the best leaders have. I've enjoyed this episode and discussion with you, Jason. It's always a pleasure. You've always given me a lot to think about when we walk away. So I thank you for the time. And I look forward to talking to you more and partnering with you and Kindred in your future endeavors. Thank you so much for today.
Thank you, Angelique. Thank you for the friendship and the partnership, and looking forward to great things with SAP and Kindred for years to come.
Thank you.